Hello, I am Dr. Tricia Berneker, an associate professor here at DeSales University, and today I will be discussing our Adult-Gerontology Acute Care Nurse Specialist program. I'd like to begin with where there's a lot of confusion, is what is a clinical nurse specialist? A clinical nurse specialist is an advanced practice nurse that have 3 spheres of influence. Those spheres of influence or impact are the patient, nursing, and the system. So what does that mean? That means if you come to DeSales University in the Clinical Nurse Specialist program, you will be educated as an expert clinician. You will have the 3 Ps. Those 3 Ps are health and physical assessment, pharmacology, and pathophysiology. You will also be educated on research, evidence-based practice, quality, informatics, leadership, management, just to name a few. You will also receive education courses as well. Then you will go and have a 500-hour practicum experience where you will go into the clinical setting and you will apply and synthesize all of this knowledge that you have obtained. You could go into a variety of settings. Some of those settings are the hospital setting, it could be outpatient community settings, or it could be at a college or university. A good exemplar would be a clinical nurse specialist in a unit-based management position or unit-based education position, because there you would have to be an expert on that patient population. You would have to be an expert on evidence-based research. You'd have to be an expert on quality metrics and on system management. So I hope that gives you a good example for that. If you would like to apply to our Clinical Nurse Specialist program, well, you would need to have a 3.0 GPA in your undergraduate program, and you would also have to have 1 year of clinical experience prior to entering your practicum experience. Another thing that I would like to mention is that the Clinical Nurse Specialist's scope of practice and prescriptive authority vary by state. I would also like to mention to everyone that upon graduation, you can also sit for the national certification exam with having those 3 Ps and the 500 hours of practicum experience. The Clinical Nurse Specialist was the first nursing graduate program here at the university, and we have demonstrated an ongoing commitment to the Clinical Nurse Specialist program because we know the value and the impact a clinical nurse specialist makes to the patient, to nursing, and to system outcomes. Thank you.